Assalamualaikum warahmatullahi wabarakatuh. My name is Elvita Nora Susana, ENT resident from Syahwala University, Banda Aceh. I would like to present my case report about management of pleomorphic adenoma of submandibular gland, a rare case. Submandibular gland is the second largest salivary gland after parotid gland. Salivary gland tumor represent 2 until 6% of all head neck tumors. Female is more often than male, mean age of 46 years old. A study report that pleomorphic adenoma was the most common benign tumor, 82.2% in the parotid with 50%, palate with 25%, submandibular with 13.6%, and sublingual with 0.36%. Excision of the tumor is the appropriate treatment. Small pleomorphic adenoma is the asymptomatic mass that is a solid, mobile, smooth surface and well-demarcated tumor. Meanwhile, larger tumor is multinodular and has pedunculated surface that can make the skin or mucosa overlying become thinner and weaker. Mrs. R, 50 years old, come to ENT clinic with chief complaint non-hyperemic lymph at the left submandibular. Initially, the consistent was hard, well-defined, mobile, pedunculated surface, and with length 10 cm with 8 cm, height 4 cm since 20 years ago. The patient was performed fine needle aspiration biopsy with the result follicular neoplasm. Also performed net contrast CT scan and found that there was a heterogeneous mass in the left cervical submandibular gland with the size length 7 cm with 5.3 cm and height 7 cm. The patient was underwent excision of the left submandibular tumor and sent to pathologic anatomy. The result was pleomorphic adenoma submandibular gland. Therefore, the patient was diagnosed with pleomorphic adenoma submandibular gland. For the surgical procedure, we perform left submandibular incision, made subplatysma flap, and then the pedunculated mass was appeared with hard consistent and finally excepting the edges of the tumor and then perform excision of the tumor. With size of length 10 cm with 8 cm and height 4 cm. 10 days after surgery, the patient was no complaint, no wound completely healed. There was no inflammation. For the literature searching with keyword pleomorphic adenoma and submandibular gland excision and can found in Science Direct and PubMed to search this case report with inclusion criteria such as first, submandibular pleomorphic adenoma. Second, excision occurs for submandibular tumors. And exclusion criteria as follows. Pleomorphic adenoma originate from other than submandibular gland. Excision of the tumor was the appropriate treatment. There are several surgical approaches to the submandibular gland including transcervical, submental, retroauricular, and transoral lateral. From the theory, female is more often than male. Etiology is unknown, but it can be family history, radiation, simian virus 40, and Epstein-Barr virus. In this case, 55 years old female diagnosed with pleomorphic adenoma submandibular gland. The tumor usually asymptomatic, slow growth, pedunculated, and with large size. In this case, lump at the left submandibular with the pedunculated, non-hyperemic, hard consistent, well-defined, mobile, and size was length 10 cm with 8 cm and height 4 cm. Fine needle aspiration biopsy has a sensitivity rate with 29 until 97%. Mead et al. Report that fine needle aspiration biopsy has a sensitivity 80.8%, specificity 95.1%, false positive 4.9%, and false negative 19.2%. The patient was performed fine needle aspiration biopsy with the result of follicular neoplasm. Net contrast CT scan and MRI are the radiologic modality. CT scan show a heterogeneous mass, the left submandibular gland in size length 7 cm with 5.3 cm and height 7 cm. Transcervical approach to avoid the marginal mandible of the facial nerve branch. 10 days after surgery, there were no complications from the patient. The recurrence rate ranged from 0.8% until 6.8%. Complete excision of the tumor along with the capsule is recommended to reduce the recurrence rate. In this case, excision of the tumor was carried out by removing the whole tumor and its capsule, so hopefully there will be no recurrence in this patient. Excising the whole pleomorphic adenoma of submandibular gland and its capsule showed a good result. Thank you.